Meet Dr. Smith. Dr. Smith treats patients at General Medical Center, an innovative organization participating in the Million Hearts model. Like you, Dr. Smith and her colleagues are participating in the model with the goal of reducing the incidence of first-time heart attacks and strokes among their high-risk Medicare beneficiaries. Dr. Smith has heard from her organization's business administrator that the Million Hearts model provides payments to accomplish this mission.
What kind of payments will my organization receive as an intervention participant?
As an intervention group participant in the Million Hearts model, you will introduce specific interventions targeted to reduce heart attacks and strokes in your high-risk Medicare beneficiaries. You will help drive innovative cardiovascular disease or CVD prevention methods that can help save lives in the next 5 years and beyond. Your organization has committed to enrolling your patients who are model-eligible Medicare beneficiaries, stratifying those patients by CVD risk level, reporting periodic clinical data, and monitoring your high-risk patients' CVD risk score throughout the 5 years of the program. Please refer to page 9 of your onboarding packet for more information about patient eligibility. These activities will provide CMS with the data needed to evaluate the Million Hearts model results, and your organization will receive payments for successful model participation. The first type of payment applies to the initial enrollment of an eligible Medicare beneficiary patient and calculation of his or her baseline risk score. These payments are called risk stratification payments and can be provided at any time during the model for any eligible beneficiary, regardless of his or her risk level, but just once per beneficiary.
Sounds good.
The second type of payment will compensate your organization for monitoring and reporting data for each enrolled high-risk beneficiary aligned to your organization. These payments are called cardiovascular management payments and will be provided only for the first year of the Million Hearts model and only for activity related to high-risk patients.
Got it.
Finally, the third type of payment will reward your organization for reducing the CVD risk among your high-risk patients over time. These are called risk reduction payments.
Makes sense.
All three of these payments apply to the activities that occur between you and the patients who are model eligible, enrolled in Medicare beneficiaries aligned to your practice by CMS.
Can you explain how these payments are calculated?
Sure. Let's start with the risk stratification payment. When you enroll your patient in the Million Hearts registry, the Million Hearts risk calculator housed on the Million Hearts registry generates a 10-year CVD risk score based on the clinical data that you or your staff submit. The CVD risk categories are high, medium, or low. Each patient will be assigned to a risk category based on his or her baseline CVD risk score. Those identified as high risk at enrollment will continue to be followed by the model. Keep in mind, these patients will be categorized as high risk throughout the model, even if their high risk scores reduces over time. The risk stratification payment is a one-time payment of $10. Your organization will receive a one-time risk stratification payment per eligible patient that you enroll and risk stratify regardless of whether they are high, medium, or low risk according to their baseline score.
Got it. So if I enrolled my patient Mr. Parker using the Million Hearts registry and gave him a baseline score using the risk calculator, we could receive $10?
That's right. Your organization would receive $10 for enrolling and stratifying Mr. Parker once his eligibility is validated against medical claims data. Remember, this is a one-time payment, so you will receive the $10 risk stratification payment just once for each enrolled patient.
I think I have it. So if I enrolled 10 patients at any point in the model, we could receive $10 each, for a total of $100.
Correct. Regardless of their CVD risk level, your organization will receive $10 for every eligible beneficiary that you enroll in the Million Hearts model.
Great, thanks. I'm going to enroll and risk stratify as many of my eligible patients as I can. This will also give me a broader understanding of my overall patient population CVD risk profile. Now, how does the cardiovascular management payment work?
The cardiovascular management payment is available during the first year of the Million Hearts model. If you enroll, monitor, and report data for high-risk patients in the first model year, your organization will receive $10 per month for the remainder of the year for that patient, and all other patients already enrolled. Unlike risk stratification payments, cardiovascular management payments only apply to activities associated with your high-risk patients. Also, keep in mind that these payments only apply to the first year of the model.
I see. So it is in our favor to enroll as many beneficiaries as we can, as early as we can.
That's right. If you enrolled and risk stratified Mr. Parker during the first month of year 1 of the model, you would receive $10 for the first month. You would then receive a full $10 for each of the rest of the 11 months of the first year as long as he remains eligible. That means your practice could receive a total of $120 in cardiovascular management payments for Mr. Parker alone.
Okay, so how does a risk reduction payment work?
The risk reduction payments will be awarded to your organization for reducing the aggregate CVD risk of your high-risk patient population. The risk reduction is dependent on the annual reassessment of CVD risk for each enrolled high-risk beneficiary. Each year, you will meet with each of your high-risk beneficiaries to gather updated data on their cardiovascular health. You will reassess the CVD risk for each high-risk beneficiary by entering their updated data in the Million Hearts Registry. Each beneficiary's current year risk score will be compared to his or her baseline risk score to measure the total change. Each performance period, CMS will calculate the average aggregate CVD risk reduction among all high-risk patients in your practice who are risk reassessed during that period. The aggregate risk reduction is the basis of the risk reduction payment. If the average aggregate CVD risk score reduction for all reassessed beneficiaries is less than 2%, your organization will not receive a risk reduction payment. If your average aggregate risk reduction is between 2% and 10%, you will receive $5 per beneficiary per month for each high-risk beneficiary re-risk assessed during that performance period. If your average risk reduction is greater than 10%, you will receive $10 per high-risk beneficiaries and included in the average for that year. So if you support all of your enrolled high-risk patients like Mr. Parker in reducing the CVD risk from their baseline scores, you could receive up to $10 per month in years 2 through 5 as long as your organization's average aggregate score is greater than 10% each year. This would total $120 per year per patient, or a total of $480 per patient for years 2 through 5.
And since the risk reduction payment is based on my organization's average aggregate CVD risk score reduction of all of our high-risk patients, our practice will really benefit by showing improvement in as many of our high-risk patients as possible.
That's correct.
That makes sense. The more success we demonstrate in reducing CVD risk across the high-risk population, the greater the payments we receive. Now, can you tell me about when these payments will be made?
Enrollment, risk stratification, and risk reduction are measured throughout the 5 years of the model. To effectively monitor and measure progress, each year is divided into 2 6-month performance periods. Your payments for events occurring during each performance period will be calculated after that performance period concludes. You can expect to receive payment approximately 4 to 5 months after the conclusion of each performance period. As stated before, you are eligible for risk stratification payments at any point during the 5 years when you enroll a new patient, but are only paid once for each patient enrolled. Cardiovascular management payments are dispersed for those patients enrolled during year 1 of the model. Risk reduction payments are based on data you enter in years 2 through 5 of the model as a result of your high-risk patient's reduction in CVD risk score.
So what is the total possible payment that my organization could receive for Mr. Parker?
Well, if we add the $10 risk stratification payment for enrollment and stratification, and then add $120 for the cardiovascular management payment, assuming that Mr. Parker joined the model during period 1 of year 1 of the model. In addition, if we assume a maximum average aggregate risk reduction payment of $120 for each years 2 through 5, for a total of $480, your organization could receive up to a potential total of $610 for Mr. Parker.
Wow, these payments could really add up if we enrolled even more Medicare patients and measurably reduced CVD risk. And I'll be improving my patients' cardiovascular health along the way.
That's right. And yes, you'll truly be making an impact on the community by reducing healthcare costs and improving the overall health and well being of the people you serve.
True, we are all ultimately aiming to reduce our patients' CVD risk. So, where can I go if I have more questions about the Million Hearts model and payment distributions?
You can contact the CMS Help Desk for more information on the Million Hearts model payment calculations and disbursements. Please also consult additional materials on this topic posted on the MHM Connect site.
Thank you so much. I'm looking forward to getting started.
And thank you for participating in the Million Hearts model.